I'm a geriatrician, and I'm going to talk about what happens to your medications when you turn 70. So it's really not so much what happens to your medications, but what happens to you that affects your medications. So I'm going to talk about 5 changes that happen to us as we age that affect our medications. I'm also going to give you some tips about how to manage these changes. No. One is your kidney function. As we age, our kidney function goes down. There are 2 main reasons for this. One is that there's just a gradual decrease in kidney function that happens to all of us. It starts probably around age 40. But another reason is that people over the age of 70 are more likely to have chronic diseases like diabetes or heart disease or high blood pressure, which can affect kidney function. The problem with this is that many of our medications are cleared from the body by the kidneys. So if your kidneys aren't working as well, then that medication may stay in your body longer than it should. And that can lead to either an increase in side effects, or it can cause the medication to build up in your body to toxic levels. A simple blood test called a GFR, or a creatinine clearance, will tell you if your kidney function is normal. If it's not, then your doctor may need to adjust the dose of your medications. It's very common. It's about 30% of adults over 70 years old have decreased kidney function, and that number goes up to about half in those over 85. And so it's very common that a medication that you've been taking at a certain dose for a long time suddenly needs to be changed because of decreased kidney function. You may think that, oh, I've been taking this medication for a long time, so why does it suddenly need to be changed? It doesn't need to be changed because of any fault of the medication. It's just because our bodies change. And so please, don't ever hesitate to ask your pharmacist or your doctor to explain why a medication needs to be changed. It's always because of something related to your body changing. Whether it's your kidney function, or your liver function, or your weight, or other things that I am going to talk about. No. 2 is your liver function. The liver helps to break down many of our medications into either more active forms or inactive forms. In general, the older that you get, the less your liver does its job. Again, this can mean that the medication stays in your body longer than intended and can cause problems. For the same reasons that you might have decreased kidney function, you may also have decreased liver function. Things like diabetes or heart disease can make your liver work less well. Also, some medications that you've been taking for a long time can damage the liver. So your doctor will want to know what other medications you are taking to decide if they might be affecting your liver function. And again, there's a blood test that can help check if your liver function is okay. If you have either decreased liver or kidney function, you might need a medication that has a lower dose. Or you may need to have the dose of that medication given less often, like every other day instead of every day. The third thing that happens to us as we age is that we have more difficulty absorbing vitamin D. Vitamin D is important for strong bones, for muscle strength and preventing falls. Many people don't get enough vitamin D. We can get vitamin D from sunlight. But then, as we age, we tend to spend less time outside. Then also our skin doesn't absorb vitamin D from sunlight as well. So many people over the age of 70 need to take a daily supplement of vitamin D. Your doctor can check your vitamin D levels in the blood with a simple blood test and then decide if you need to take a supplement. And there are different kinds of supplements, so you may need one that has more vitamin D than another. No. For as we age, we have more trouble swallowing pills. And there are a lot of reasons for this. One is that the muscles in your throat can become weaker. Another reason is that your saliva glands make less saliva. Saliva helps to lubricate the mouth so that you can swallow the pill easily. Saliva also helps to dissolve the pill so that you can taste the flavor of the pill, and that makes it easier to swallow. Some people also develop difficulty seeing or smelling, and that can make it harder to swallow the pills. So there are lots of different reasons why it becomes harder to swallow pills. Fortunately, there are lots of things that we can do about this. One is that you can ask your pharmacist if there is a liquid form of the medication that you're having trouble swallowing. Sometimes there is. Another thing is, there are a lot of different ways to make it easier to swallow a pill. There are some great videos on YouTube that show different techniques. I'll link to them below. You can also ask your doctor if it's okay to crush up the pill and then put it in applesauce or something else. Sometimes it's okay to do that, but sometimes the pill needs to be kept whole for it to work right. If you're having trouble remembering to take your medications, there are also some great resources online that can help you. I'll link to those below too. The fifth thing that can happen is that your stomach acid becomes less strong. Stomach acid is important for helping to break down the food that you eat. It also helps to activate some of our medications. So if your stomach acid becomes weaker, that can make it harder for some medications to work. These are called prodrugs. So for example, one medication for high cholesterol is called atorvastatin. It comes in a tablet that you swallow. When it gets to your stomach, the acid helps to activate the medication. So if your stomach acid isn't strong enough, then that medication might not work well. Other medications like aspirin or ibuprofen, they actually work better if your stomach acid is weaker. So that S, one of the reasons why people who have heartburn or GERD or other things where their stomach acid is too strong might find that these medications work better for them. But in general, most of our medications are designed to work best in a stomach that has enough acid. Not too much acid and not too little acid. So what can you do about this? Well, if you're taking a medication that works better with stronger stomach acid, you might need to ask your doctor about taking a medication to strengthen your stomach acid. You can also ask your pharmacist about foods that you can eat before taking the medication that will help the medication work better. I'll talk about that more in a moment. Now, the fifth thing that can happen is that your taste buds can become less sensitive, especially your sense of taste. And your sense of smell can also go away a bit, which can make it harder to taste things. Now, this can make it harder to remember to take your medications, but it can also affect how well your medications work. A lot of our medications either taste bad or they make the food taste bad. So we might forget to take the medication, or we might not take the full dose because it tastes so bad. You can ask your pharmacist if there's a different form of the medication that you can take. Maybe there's a liquid or a chewable tablet or something else. But you can also ask your pharmacist about foods that you can eat with the medication that will help the medication taste better or help you remember to take it. And I'll talk more about that in a minute. The sixth thing that can happen is that as we age, we tend to have less muscle mass. Muscle mass is important for helping us to move around and keep our balance and strength. People who have less muscle mass are more likely to fall and to fracture a bone like the hip. As people age, they also tend to be less active, and that also leads to less muscle mass. One way to prevent this is to be as physically active as you can. If you're able to do things like walking, swimming, yoga, strength training, whatever you're able to do, it will help you maintain your muscle mass. You can also talk to your doctor about medications that can help increase muscle mass. Now, what happens if you miss a dose of medication? Well, it depends on the medication. Some medications, like antibiotics, need to be taken at a certain dose at a certain time each day. So if you miss a dose, you need to make it up. Other medications, like some blood pressure medications, it's not so important to take them at a certain time. You just want to take them regularly. And what if you start to feel better and you think you don't need the medication anymore? You never want to stop a medication without asking your doctor first. Sometimes it can be dangerous to stop a medication. For example, if you've been taking a blood pressure medication for a long time, it can be dangerous to stop it quickly. If you want to talk about stopping a medication, you need to schedule a visit with your doctor and you need to ask them. There's a lot of things that can affect how well your medications work. You can learn more about them by taking a class. I've got a free class online called How to Get Your Medications Right. You can sign up for that below. And I also have a class that teaches you how to use food to help your medications work better. So if you're interested in learning more about that, you can find out about that below as well.